Alrighty.
All right, good afternoon, everyone. Welcome to today's webinar. I am Sandy Duke. I have the pleasure to serve as your president for ACHE of Georgia for 2026. And it's truly my privilege to welcome you today to our webinar on the future of patient care using nutrition and lifestyle to reduce costs and improve outcomes with our guest, Dr. Joe Esposito. Something near and dear to my heart, and I'm really looking forward to today's webinar. Before we get started, I just wanted to take an opportunity to thank our sponsors. They are the financial engine behind our ability to bring you this rich programming. And so we're going to specifically call out our platinum sponsors, Emory Healthcare, City of Hope Cancer Center in Atlanta, Grady, Kaiser Permanente, Premier Anesthesia, and Wellstar Health Systems. Bruce is going to put up our gold and silver sponsors. We appreciate all of their support. As always, I want to put a plug in for membership. We would love to have you be a member of ACHE of Georgia. And the way that you do that is by joining National. So if you'll go to ache.org and join and put in your state of Georgia, you'll automatically be a member. For those of you that are already members, thank you for being with us. And for those of you that are not in Georgia, thanks for being part of our program today. We're always excited to have others from across the country join us. Usually have several even that are outside of the country that join us. So again, welcome. Another important push for us this year is advancement and people obtaining their fellowship. And so we have a bold goal this year to hit our target, which is going to be about 40 new fellows. And so for love for you to be a part of that cohort that are going to walk across the stage next February. And so we have an annual Board of Governors tutorial series, and that starts tomorrow. And so we're excited to have that kick off tomorrow. And so love for you to be a part of that if you're interested. There's still time to join, and love to have you be a part of that. And Larry Tyler, who's with us today, will be celebrating his birthday with us tomorrow as a part of that series. And so come here, Larry, talk about that and celebrate his birthday with him. Um, we have a lot of resources for you to help study for your exam. And so access all of those. And again, let's help us meet that goal of advancement for the chapter. There is an opportunity to get an exam waiver as well. And so they offer an annual period of time where you can get a fee waiver when you pass the exam, and that's runs through June 30th. So go ahead and register for the exam, make that commitment, put the flag in the ground that you're going to pass this year, and you have the opportunity to save about $225. I want to do a quick highlight of some things that are coming up. Something we're really excited about is our Clinician Executives webinar, which is on June 11th at noon, with our featured speaker, Jason Lissandrini, who will cover ethics and professionalism. That's sure to be a great event. On June 18th, we have lunch with a healthcare executive. This is a cool series we've kicked off this year, and it's an opportunity for folks to spend some time with some of our C-suite executives that are members of our board and team. And so Lindsay is the CEO of Piedmont Newton Hospital, and so she's going to be hosting a lunch with folks. And so there's some limited slots still available if you're interested in joining Lindsay and learning about her journey to the C-suite. The QR code you can see there on the screen. Love to have you be a part of that. This will be a monthly series. I'll be hosting one in Macon coming up later this summer. And those that we've had so far, we had one in Athens and we had another here in Macon earlier with Lorraine. Went really well. Access our events page at acheofgeorgia.org for more details and registration on that. We have a podcast series, and our own Debbie Dalton, who's Chief Medical Officer at Wellstar Paulding, will be hosting a webinar on pediatric ER physicians to the executive suite, navigating healthcare leadership. And so this will be hosted by our programs committee member, Yana Hicks, but sure to be a great event. Debbie's had a storied history of leadership. Will be a great event spending some time with Debbie. So I encourage you to join them. ACHO Georgia also offers several ways to stay connected, and that includes many of our social media platforms, Facebook, LinkedIn, and Twitter. So connect with us. We'd love to have you be a part of our online community as well. A little bit about today. You have an opportunity to get 1 hour of ACHE qualifying educational credit. That is a self-reported credit. So go to my ACHE on the ACHE Nationals website, and you can claim your 1 hour of credit for participation. So be sure and do that. And that'll help with either if you're on your journey to fellowship, getting those hours, or if you're in your credentialing cycle, re-credentialing cycle, it's an opportunity for you to capture those. So with that, I'm going to turn it over to our very own Larry Tyler, who will introduce today's speaker. Thanks.
All right. Thank you, Sandy. It's good to be with you all. I wanted to tell you a little bit about Joe Esposito. He's obviously a well qualified. You can see his credentials there on the screen. I first came across Joe while I was in the car listening to Eric von Hessler, who is I guess you'd call him a host, and he's got a whole entourage. And he was having Joe on as a speaker. And I was listening to it, and I thought, this guy, Joe Esposito, is pretty darn good. He's really knowledgeable about what goes on. But the other thing that really impressed me about Joe was that he could hold his own over Eric von Hessler, who has the tendency to talk over everybody that comes on there. And I thought, well, this is pretty interesting. Fast forward, senior execs on deck. I'm sitting there having a beer in the suite, and up walks Joe Esposito to introduce himself. And I said, why are you coming over here? He said, somebody sent me to you. Oh, good. All right, fine. So we started chewing on different things, and it was really a great opportunity to understand what he was about. He's about wellness. He's about the future of medicine. He's about everything that the future is bringing to us. Now, I just came back from Vancouver. In Vancouver, we went to see my daughter, who is a doc, and she is into lifestyle medicine. And the Canadians actually see that as a direction that they're taking their patients. It's a national health system. And so on top of that, I got to eat vegan for the whole week. And I will tell you, it was really good. And I've had some vegan stuff here. We have a vegan restaurant, I guess they've just about gone out of business, called the Slutty Vegan. And that name always turned me off. But anyhow, the net result is, in last week's Wall Street Journal, there was an article about Jim Beam and why they have so much whiskey there they can't get rid of. As you know, whiskey takes a while to age. And what's happening is the population is drinking less and less. So those are some of the things that I've observed. But Joe is going to take us out of the morass that I have just developed and going to straighten us all out about lifestyle and healthcare and everything that we need to know about what's coming in the future. So, Joe, take it away, my friend.
Thank you so much. Yeah, I've been in practice 41 years now, so I've seen a lot of changes in my career. So I jump right into it. I won't have a lot of time. I host my own radio show as well on WSB. I believe we're the #1 health show in the country on wellness. I've been on Dr. Oz's show. He's been on my show. And so, Larry, you're absolutely right. The trend is definitely going toward the holistic lifestyle medicine. And I don't want us in Georgia to fall behind. I want us to make sure we're staying on board. So in a nutshell, 41 years of research in 20 minutes, right? There's 3 things we have to look at in order to obtain and maintain good health. That would be a normally functioning nervous system, normally functioning digestive system, and good nutrition. And digestion, I've been in practice 41 years. I'm board certified in pain management, actually, and one of my boards. And so we see a lot of pain patients from all over the world come and see us because we do it without drugs and surgery. Now, if we need drugs and surgery, we refer to the hospital, we refer to doctors, and we co-manage the cases. So pain is the #1 reason we see patients. The #2 reason we see patients, digestive problems. Heartburn, acid reflux, burping, gas, bloating, diarrhea, constipation. Everybody's got it. Nobody talks about it. And so many times people suffer or they try to take a medication to cover up the symptoms. We want to try to get to the cause. Because if we can get the digestive system working, the body works better. I do a whole seminar on traumatic brain injury. I'm certified in traumatic brain injury. And I do a seminar on the gut-brain reaction to traumatic brain injury. And we can diagnose the heck out of a TBI, but what do we do about it? What happens when I send Larry home with his TBI and I say, okay, we're going to monitor this, but what does monitoring look like? Let's talk about things. For example, when you have a traumatic brain injury, the brain releases glutamic acid. Glutamic acid irritates the nerves and causes pain. So what happens if I tell a patient to go home and they go out and have Chinese food loaded with monosodium glutamate, glutamic acid, aggravating the traumatic brain injury? Somebody's got an issue with their digestive system. They can't absorb nutrients. So what can we do about that? Let's start with the stomach. The stomach's main job, pretty simple, is to break down proteins into something called amino acids. Now, if we look at a human diet, there's 20 amino acids. So I eat a carrot, like Larry had maybe up in Vancouver, or I eat a steak. The protein looks like a ball of yarn under a microscope. My stomach has these chemicals in it that unravel the ball of yarn and then chop it up into something called amino acids, 20 amino acids. So the amino acids then pass into the small intestine. My pancreas kicks in and helps with the digestion of proteins again, but the pancreas also helps with fat and carbohydrate digestion. And then the gallbladder kicks in and helps with the fat again. So I know I'm talking fast, it's a lot to cover, but if my stomach isn't working properly and I'm not able to break those proteins into amino acids, these partially digested proteins pass from my stomach into my small intestine, where essentially they putrefy, they rot. And that'll give you the burping, the gas, the bloating. But more importantly, I'm not breaking down the proteins into amino acids. So what does that look like, let's say, from a neurological standpoint? The amino acid tryptophan combines with vitamin B6 and creates a chemical called 5-HTP. 5-HTP becomes serotonin. Serotonin is produced 90% in the gut, about 5% in the brain. So serotonin helps me focus, makes me happy. Serotonin converts into melatonin, which helps me sleep. How many of us have sleep issues? A lot of us, most of us, especially as we get older. One of the reasons is we're not breaking down our proteins into amino acids to produce neurotransmitters. I know that's a lot to cover there. But we have to make sure we have the proper B vitamins. Healthy bacteria in the colon produce B vitamins. It's called a postbiotic. And we have to make sure we're breaking down those proteins. So as we get older, some of you may be a lot younger, but as you get older, 30s, 40s, 50s, 60s, older, your stomach acid levels drop. And so what do? We can't break down those proteins. So we can't get the amino acids. The body can't heal because the body uses amino acids to heal. So what if we did something really simple? I'll get off the complex stuff for a second. What if we had a simple way to increase our stomach acid? Back to maybe close to the way it was when we were a kid, to break down those proteins. And the amino acids become neurotransmitters, but become every cell in the body. Tyrosine becomes dopamine. Dopamine gives you pleasure. Dopamine becomes norepinephrine, which gives you energy. How many people are tired all the time? Most of us. Yeah. A lot of it goes back to the gut. So we're going to talk about how it affects you. Then we're going to talk about how it can affect the hospital. So a simple thing, like taking a tablespoon or two of raw organic apple cider vinegar, can stimulate the stomach digestive capabilities to break down the proteins. How many people have acid reflux? A lot. And if you've ever read the instructions on the acid reflux medication, it says use for usually like 6 weeks, 8 weeks, and then discontinue. And then start up again if necessary. We have patients taking it for 20 years, 30 years, reducing their stomach acid, reducing their ability to break down proteins. So if we can actually increase the stomach acid, I know it's counterintuitive, we can break down the proteins more efficiently, and many times that solves the acid reflux problem. Wow. So something as simple as apple cider vinegar would be phenomenal in your life. Now, I don't like apple cider vinegar. I don't like anything tart. I like sweet. So what I'll do is I'll use it as a salad dressing. Amazing results. I take a digestive enzyme supplement as well because at my age, I'm in my mid-60s. At my age, I can't break down food like I used to. I can't eat a pizza and a 6-pack and go to work the next day like I used to in high school. I need to give it a little boost. So something as simple as working on the digestive system, very simple, easy, quick fixes. This is for you now. Amazing results. And it helps brain function. Because what's one of the big things we have to worry about as we get older? Dementia. Dementia is called the type 3 diabetes. It's an issue with insulin. It's insulin resistance. And then the mitochondria in the cells can't get enough insulin, it can't get enough sugar, and so they can't generate electricity. Now, it's not the only cause, But that's a cause, if we look at it from a nutritional standpoint, to incorporate as we co-manage those cases. Wouldn't that be wonderful? I don't know if you've ever dealt with somebody with dementia, but I used to date a gal and her mother had it. And I thought it was a joke. My first exposure, probably 20, 30 years ago. Who are you? I'm your daughter. I don't know you. So if we've worked in a hospital setting, we've run into these cases before, but it's heartbreaking. And a lot of it is mitochondrial dysfunction. One cell in the brain, one cell can have up to 2 million mitochondria. And if those mitochondria aren't generating electricity properly, the brain can't work. So I'm not saying this is instead of the treatment that we're doing. This is just additional, either free or very inexpensive boosts that we can do just as adults to try to get the brain working more efficiently. And now the nervous system's a biggie too, because this is something that you may have never heard this term before, a viscerosomatic or somatovisceral response. So somatovisceral response is I pinch my nerve in my neck, okay? I used to have association with Shepherd Spinal Center many, many years ago. And I didn't work there. I knew a gal who worked there. And if you broke your neck at the 4th cervical vertebrae, above that, you're on a vent. Below it, you weren't on a vent. Why? Because the phrenic nerve comes out of the neck and supplies the diaphragm. We know that. That's basic neurology. But what if I just pinch that phrenic nerve? What if I get in a car accident and I put pressure on that phrenic nerve? That's going to affect my diaphragmatic function. That's going to affect my breathing. I'm not getting enough oxygen. I'm tired all the time. I teach a lot of TBI and gut-brain axis on traumatic brain injuries to doctors all over the country. And so when you look at a traumatic brain injury, yes, we have trauma to the brain, but we also have trauma to the neck. So if I pinch the phrenic nerve, my diaphragm can't work. I can't breathe enough properly. I get tired all the time. It speeds up the aging process. So now we start looking at the body as a physical machine, not just a chemical machine, which is kind of cool. And this is where we talked about functional medicine or functional medicine or lifestyle medicine. So if I have a pinched nerve going to my diaphragm isn't going to work properly. What if I have a pinched nerve going to my colon, my spleen, my liver, my gallbladder? Those organs may not be working properly because of a somatovisceral response. And in medicine, we never seem to check the nerve supply to the liver as we're treating the liver or the kidneys or the spleen or the sex organs. If you watch TV, every third commercial is for little blue pills. Well, they'll treat the symptom, but they don't treat the cause. So I always want to check the nerve supply to an organ, any organ, doesn't matter, heart, lungs, liver, spleen, colon. I want to check the nerve supply to the organ. But we have to think about this. 90% of our nerves don't feel pain. I'll say that again. 90% of our nerves don't feel pain. So you can have a damaged nerve and not know it sometimes. So if we were live, I'd show you a way we can test nerves that don't feel pain. So we want to get the nervous system working. We want to get the digestive system working. And we want to get the diet straightened out. Now, I'm going to show you a quick trick. I wish we were all live. I can show it. I demonstrate it on somebody. But the way the brain works is the right side of the brain controls the left side of the body. Left side of the brain controls the right side of the body. So all day, every day, we sit at our desks. We work on our computers. We brush our teeth. We talk on the phone. We open our door in our house. We use one side of our brain more than the other. So we segregate the brain as opposed to integrating the brain. Understand? You're using one side of the brain more than the other, so you're segregating. So what I want you to try, and this is really cool. If it doesn't work, it doesn't work. It's free. I want you to try integrating your brain every hour. And the easiest, quickest, simple way to do it is something called a cross crawl. So every hour, if you stand up at your desk, and you stand up and you march, you bring your right elbow to your left knee and your left elbow to your right knee. Okay, so this type of motion. Now, if you do it sitting down, that's fine too. Okay, standing up's a little better. But if you can do that for 10, 15 seconds an hour to reintegrate your brain, this is called functional neurology, suddenly you start to get energy back. How many of you at the end of the day are just exhausted? I don't want to go. I got to go home. I got to cook. I got to deal with my spouse, my kids. I want to go to a party, but I'm tired. Simple things like integrating the brain with a cross crawl will help reset or reboot the brain, basically. Amazing results. I've worked with the U.S. Olympic team, the Cuban Olympic team, and that's one of the tricks I teach them, to integrate the brain. And I've worked with high school athletes before an event, because the body's going to work more efficiently when we integrate instead of segregate. Now you can use those same things as well. Trying it now. There you go. Excellent. Yeah, it's right arm, left leg, left arm, right leg. It's just amazing. I do it before every radio show, before every television show, before every podcast I do. I do about 20, 30 seconds of that. Incredible how much better you'll feel. So that's working on the nervous system. We want to make sure the nervous system is working, and that's a little trick to integrate it. We want to make sure you don't have pinched nerves, and then you want to make sure the digestive system is working to break down your food, to absorb your nutrients, and then I'll talk about diet in just a second. But pinched nerves, that's such a big issue for everyone. I don't know anybody who doesn't have any pain. We all have pain, sometimes more, sometimes less. I've actually put together a whole protocol. I'm going to be speaking to a workers' comp company coming up on how they can lower their costs. And I've done the double-blind study research. I've done it all. For a big company, let's take, I don't know, Delta, for example. Minimum savings, if you sent the patient to the right doctor to begin with, 30% on spinal injuries, 70% overall for workers' comp. How much money would a hospital save if they saved 70% on their workers' comp cases? For the employees, not seeing patients, but the employees. And it's so easy because we just have to know which doctor to send them to. So many times we have a back pain, we send them to an orthopedist. Orthopedist says, okay, we can do some physical therapy. If not, then we can do some injections, 3 injections in one area, and then we can go ahead and move to surgery. That's wonderful. However, what if there was another alternative? What if the person is just totally inflamed? I have a traumatic brain injury. I was hit by a car when I was 10 years old. I was in a coma for 4 days. So I have a TBI. That's why I'm really good at this stuff. I can't drink caffeine. If I drink caffeine, I get a headache. But I had to figure it out myself. How many people are out there having a coffee every day, having a headache, and they keep coming back to the hospital? Readmission. The insurance company's denying it. Well, we don't know. You can't find anything wrong. We're going to deny the claim. You're not getting paid. Patient isn't getting better. Now we just do a simple evaluation. Write down everything you eat for a week. Everything. If you have a piece of gum, if you have a piece of candy, if you have a cup of coffee, write it down, and in the margin, write down your pain level. It's free. So many times the patients will say, I didn't have a headache on Tuesday. Okay, what didn't you do on Tuesday you did on every other day? Oh, I didn't go out for my coffee. That's just an example. So when we start looking at how the body responds to diet, then many times we can figure it out. Number 1 food allergen, what do you think it is? Dairy products. Number 2 food allergen, wheat. So if somebody has irritable bowel syndrome, Crohn's, colitis, we can say, all right, let's cut out the wheat and the dairy and let's see what happens. But what if they just have bloating? Let's cut out the wheat and the dairy for 2 weeks and see what happens. If it doesn't work, guess what? It didn't work. So what? Didn't work. Didn't cost you anything. But now we start seeing the benefits of incorporating these three things: normally functioning nervous system, normally functioning digestive system, and good nutrition. And you see the GLP-1s, of course, are huge now. 1 in 6 people, I think, are taking GLP-1s. Well, we can stimulate our own GLP-1 production. There's a probiotic called Akkermansia. Akkermansia helps produce short-chain fatty acids that activates the L cells in the small intestine. The L cells produce GLP-1s without the side effects of the GLP-1s. Now, it's not as powerful, takes a little longer, but it works great. So we understand the physiology of how the body works. We can hack it. I call it biohacking, right? We can hack into the body and make it work. So let's talk about diet, because that's always a big one. And that's the one thing you have control over. You control what's on the end of your fork. Larry was just saying he went to a vegan restaurant and the food was phenomenal. There's a lot of good vegan restaurants in Atlanta, but it doesn't even have to be a vegan restaurant. I love Thai food. I don't know about you. I love Thai food. But Thai food many times uses fish sauce. Fish sauce is loaded with monosodium glutamate. Glutamic acid in that concentration is an excitotoxin to the brain. And it can give you dizziness, it can give you headaches, it can give you blurred vision, it can affect your sleep. So a simple thing, like if I go to a Thai restaurant, I have to say, listen, I can't do fish sauce. I'm very allergic. Can you make whatever dish without fish sauce? The answer is, yeah, sure, of course. Tastes just as good, doesn't have the fish sauce. So jokingly, years ago, I was giving a lecture one time, and I was joking around, and I said, the 7 deadly sins of nutrition. Well, it's become one of my focal points in my career now. The 7 deadly sins of nutrition. I talk about alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. And if you're the average person, you just said, well, Joe, that's my whole diet. I only eat alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. So let's break it down because there's a negotiation with every one of them. Alcohol destroys brain cells, right? Most people remember that. Maybe some of you forgot that. But alcohol destroys brain cells. Alcohol affects vasopressin, a chemical in your brain that prevents you from peeing, antidiuretic hormone. So all you have to do is very simply, if you're going to have a drink, have 3 glasses of water. Now, that's a lot of water. You're going to be peeing a lot, but you rehydrate the brain. Take a methylated B complex, because about 50% of us have an MTHFR gene flaw, which means we can't methylate. We can't convert folic acid into folate. So if you have that gene flaw, I have it. I did a test. I have it. If I take folic acid instead of folate as one of my B vitamins, I can build up toxic levels of folic acid. So why don't we just give people folate? Very simple. We can give people cyanocobalamin, which is a B12, but cyanocobalamin means it has a molecule of cyanide on it. Why don't we just give them methylcobalamin, because the cyanide has to be converted anyway, and we take the cyanide out of their body. So if you're going to go out drinking, a methylated B complex and 3 glasses of water. I'm not saying don't drink. Just saying if you're going to drink, mitigate the damage. Sugar weakens the immune system. Okay, sugar feeds yeast in the body. A lot of us have yeast, systemic yeast infections. So if we can mitigate the sugar, that's great. So what can we use instead? Stevia, Lohan, xylitol. There are alternatives that we can use. So sugar, artificial sweetener, aspartic acid is an excitotoxin to the brain, just like monosodium glutamate. Headache's #1 side effect of aspartame. And it affects the microbiome in your colon. Microbiome is 70 to 80% of your immune system. So let's maybe cut that out. If you're going to do animal products, meat, butter, cheese, yogurt, eggs, ice cream, organic only. But Dr. Joe, there's not organic around. Well, then we go to Larry's diet and we go to a vegan diet or a plant-based diet. I've been plant-based for 40 years now. It works. If it didn't work, believe me, I've eaten meatball sandwiches every day. I'm Italian. I miss my meatball sandwiches. But you have to make a decision in your healthcare. What's going to be best for me? Is it the best choice right now? Is it worth it? I use that every day of my life. Is it worth it? So the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, big issues there. You can mitigate every one of them or just maybe cut back and try other things. If you don't like it, don't do it. But always try to think, is this the best choice I can make? So for you, I'm watching my time here, and we're going to take questions at about, I think, 40 minutes in, okay, 12:40. If we can get the nervous system working, if we can get the digestive system working, if we can get the diet straightened out, phenomenal results, in addition to everything else we're doing. So hospitals are amazing. Acute care, trauma care, surgeries, diagnostics, life-saving interventions. That's not my world. People call me sometimes and they'll say, Larry and I were talking about this before. Well, Dr. Joe, I don't want to do any drugs. Well, you have high blood pressure. We need to bring that blood pressure down. I don't want to take any drugs. You need to. Then we can work to find out why you have the high blood pressure. Maybe it's a kidney issue. Maybe it's a digestive issue. The nervous system, the nervous system that controls your digestive system is called the enteric nervous system. It's controlled by the parasympathetic part of the body. Parasympathetic slow us down. So many times in my career, I have patients come in and they have high blood pressure. They're thin, they're in good shape. Why do they have high blood pressure? If the stomach pushes up into the diaphragm, you might have heartburn, acid reflux. We talked about apple cider vinegar, but sometimes we need to physically pull the stomach down away from the diaphragm. It's a massage technique. And we pull the stomach away from the diaphragm. It closes that sphincter, so it stops the acid reflux. And now we take the stress off the vagus nerves and the enteric nervous system, which then goes into parasympathetic mode, which lowers the blood pressure. There are supplements like citrulline, which converts into nitric oxide, lowers the blood pressure instantly, 20 minutes. I have patients come in, high blood pressure. I don't want to start treating them. I'll get them on some citrulline. Here, take a couple of these capsules. Let's wait 20 minutes. Blood pressure drops. So there's so many ways that we can co-manage these cases. Physical, pulling the stomach down, checking pinched nerves, looking for muscle spasms. I had a case come in the other day. They wanted to do a rod in his spine. He had scoliosis. And I did an evaluation on him, and he had a psoas spasm. The psoas is a muscle that runs from your spine to your leg, and it was spasmed. So if we had done the surgery in the hospital, it would have been successful, I'm sure. However, if that psoas was still in spasm, guess what? It would have kept pulling him out of place. So it takes 20 seconds to get a psoas to come out of spasm. So I did the work on him, and I said, okay, let's see what happens. And so he just started last week, so I don't know what kind of results we're going to get on him. But in addition to the surgery, we needed to do the psoas treatment. Would have been phenomenal. And hopefully, maybe we can avoid the surgery. But if not, the surgery is going to be much more successful. So the big picture here is we want to keep patients healthier longer, reduce preventable utilization, improve recovery outcomes, support staff wellness. I don't know how many of you in charge of staff, but it's very expensive to find a nurse, hire a nurse, train a nurse, or a doctor, or an admin. If we keep the staff healthy, it's going to reduce your cost dramatically. So if we can reduce your workers' comp costs, and we can reduce your staff turnover and sick days, that alone is worth considering this. So we want again, I'm looking at time here. Let's reduce readmissions. All of you would love to reduce your readmissions, right? Many readmissions are tied to what? Poor diet, chronic inflammation, obesity, diabetes, stress, poor sleep, non-compliance. A couple of years ago, one of my friends, an orthopedic surgeon, said, Joe, I'm having a big issue. I said, what's the problem? He says, I can't get medical clearance to do my surgeries on some patients, high blood pressure, diabetes, obesity, smoking, whatever it is. They can't get the surgical clearance. They can't do the surgery. The hospital doesn't get paid. He doesn't get paid. The patient doesn't get care. He said, can I start sending you a few patients and let's see if we can co-manage these? I said, sure. So I won't mention the big orthopedic group he works for. And he started sending me patients, and I put him on a 60-day protocol, diet, supplements. If the stomach was up against the diaphragm, maybe that was the cause of the high blood pressure. 100% of the cases he sent me that were compliant, he was able to do the surgery on. Patient got the surgery, doctors got paid, everybody was happy. I see this a lot in auto accident case. I know hospitals don't play in the auto accident world very well, but very much. But if there's an auto accident case, the case can't be settled if the patient can't get the surgery, case sits there. So doctors and lawyers will send me patients. We put together a wellness protocol for them, get them well enough so they can close out the case. So there's a financial benefit, but also a wellness benefit to the patient. So potential benefits, lower 30-day readmission rates, better chronic disease management, improved CMS quality scores, and that can help lower your penalties as well. And we can do this as a seminar. We can do it to training, whatever you want to do. I'm happy to do it with you. But you're going to get better surgical outcomes because if the patient is healthy going into the surgery, chances are they're going to be healthy coming out of the surgery, which is going to look a lot better on your records. And that's something we don't think about. Yes, we got medical clearance, so they're barely safe enough to go in. But are there other things we can teach them to get well before they go into the surgery? And you get better outcomes. But then the insurance companies say, oh, well, this hospital is doing a lot better. I like that. I'd rather send somebody over to that hospital or approve those surgeries a lot quicker because I see their outcomes. And that's something that we can be proactive about, not just for you, but for your patients as well. Musculoskeletal problems. Most of my doctor friends, unless they're pain docs or orthos or neuros, they don't want to play with these things. These, quick emergency rooms, you get a musculoskeletal problem. What are you going to do with them? Give them some medication, send them home? Yeah, but then you may have a readmission again. So with the musculoskeletal issues, let's find out what's going to be the most effective, least expensive treatment for musculoskeletal issues. In most cases, chiropractic care is the most effective, least expensive treatment for back pain. It's not a surgical case. It's not quite to that level. All it is going to be medicine and go home. They're going to come back to you and say, hey, I want back in. I didn't get fixed. And then we can also reduce the opioid prescriptions as well. So sending the patient to the right doctor is so important because I can't do surgery. You send me a surgical case, I say, listen, I got to send this out to my surgical friends. But what happens when we get somebody who has PTSD and they have a digestive issue, so they're not producing neurotransmitters properly? If we fix the digestive system, it may not fix the PTSD, but it gets them on the road to getting well. It's a different way of looking at things, I know. Improving the digestion, I can give you 10 hours on digestion alone. Leaky gut syndrome, probiotics, prebiotics, postbiotics, but we got to fix the gut. And if we can do that on our patients, it's great. Now, when it comes to employee wellness, reduced burnout. less chronic pain, fatigue, poor sleep, digestive issues, anxiety, depression, weight gain, inflammation. Very simple. I do a lot of consulting with big firms, and I'll go in and do a seminar kind of like this for their employees. 6 months later, they're calling me up saying, my staff is still talking about that. Barbara didn't know that the diet soda she was drinking was causing her headaches. She cut out the diet soda, headaches went away. Guess what? We're paying Barbara the same amount of money, but she's a heck of a better employee. So simple things like that are just amazing when you start seeing the results. And when it comes to employees, I'm very cognizant of the time here. We got to start thinking about a better retention. Why would somebody want to stay with a company? Most of my employees, I have 20 employees in my 3 offices, 17 years, 20 years, 18 years, because we make it a very healthy environment. And if there is an issue, they know where to come to get to the cause of the problem. So there's so many sick days reduction, morale improves. Companies love doing wellness protocol seminars for their employees, and especially with you guys, because you're dealing with such high-level employees, professionals. You want to hang on to those people as long as you possibly can. And I know every one of you, I know when we open a question and answer, I hope it's going to blow up. You're thinking, yeah, but what about my foot pain? What about my knee pain? What about because what's in it for me? That's the way I look at things too. And then we talked about cutting the workers' comp costs. Preventative conservative care is far less expensive than surgery. I understand surgery is part of the business model, but if we can get people healthier going into the surgery and then coming out of the surgery, we're going to see amazing results. And it's going to skyrocket the reputation of your hospital. I don't treat cancer. Patients come to me almost every day. Dr. Joe, I want a holistic cure for cancer. I did a post on social media. We have about 1 million followers on social media. And I said one of my patients who we did a nutritional protocol, and okay, we can start Q&A in about 5 or 10 minutes. Thank you. Okay, thank you, Bruce. And I got her on a protocol specifically for kidney health. And she went from 28% kidney function to 52% kidney function. And just the other day, she came in. Her name is Connie. She's happy to tell me she's given me permission to use her name. And she said her nephrologist said, basically, you're not in kidney failure anymore. For 2 years, you've been staying at 52%. We're amazed. Whatever you did is amazing. So I post on social media, and I post a lot of stuff. I must have gotten, I'd say 300, maybe 400 requests. What did you do for Connie? What did you do for Connie? And I start out every answer by saying, this is not a cure for kidney disease. But we tried to get her healthy enough so the kidney had some capabilities to returning to slightly normal function. So there you go. Okay, so you understand that then, Marion. Yeah, okay. Injury and 60. Okay, we'll get to that question in a second. So when you start to see results like that, one of your sponsors, I won't say who, I refer my cancer patients to. And the reason is they called me up one day and they said, I want to take you for a tour of our facility. They had a limousine pick me up. I thought that was really cool. Brought me down there, and they had vegan options, as Larry was talking about earlier. They had vegan options in their cafeteria. So a lot of hospitals are starting to see the benefits of incorporating the holistic healthcare, not instead of, in addition to. And if a patient becomes healthier, utilization decreases, complications decrease, length of stay decreases, everything changes. And you guys are going to look so good in the public eye. And a lot of companies have used my name in vain. They say, we're associated with Dr. Joe. Well, no, you're not really. So please, I got to be careful. Years ago, I've been on WSB radio now for 17 years, and we're the #1 talk radio station in the country. And my boss told me years ago is to be very careful who you are. Everybody's going to want to say they're associated with you. So be very careful with that. So I'm happy to work with you guys in any way I can. And we can decide, later on if you want to reach out to me, you're more than welcome to do that. But if we start seeing increased patient satisfaction scores, my office, I love Google reviews. I got a 4.9, I think 4.9 review on Google, 4.8. We love that. Hospitals love that too. You know that. So now suddenly we're taking it, not changing anything, we're just adding this little tiny tweak. If we could teach that cross crawl, the neurological integration, holy cow. I do this a lot for senior housing. I'll do seminars for senior housing. And one of the things I teach is fall prevention. Because how expensive is it for a senior housing group when somebody falls and breaks their hip? A lot. One group came to me and said, Joe, if you can keep my residents here, now that you want long-term stays there, right? If you can keep my residents here 6 months to a year longer, I'll give you anything you want. He says, just turning over a room in a senior housing, a nicer one, is about $10,000 to $15,000. I said, that's easy. I said, do you test all your patients for vitamin D? No. Okay, tell your patients when they get their blood work, get your vitamin D3 D test. And if you take vitamin D3, you have to take it with vitamin K2. Because one of the things vitamin D does, it takes calcium from your food and brings it into your blood. K2 takes it from your blood and brings it into the bones. So if you're giving somebody vitamin D3 without K2, you have a tendency to build up calcium in the arteries and increase your risk of heart disease. They said, how much would it cost to give somebody vitamin D3 with K2 every day? I said, about 11 cents. Wow. So there's so many cool things that we can do with this. Community relations and marketing differential. I love marketing. I mean, I love doing this, and this falls under the area of marketing. But so how do we differentiate our hospital from all the other hospitals? How do I differentiate my office from everybody else? Before we started, Larry and I were talking. Larry says, well, most chiropractors have 1 clinic, 1 doctor. You have 3 clinics, 6 doctors. How do you do that? Well, people know who we are. We get great results, and that works for the hospitals as well. So hospitals are phenomenal at saving lives in crisis. I've been to hospitals before. You've saved my life. Phenomenal. But most chronic diseases filling hospital beds are preventable. And many times, if it's a Medicare patient, you know it's not very big on reimbursement. So what can we do to get the most effective, least expensive treatment for all the patients, yourself included? And that's where I want to step in and try to help you the best I can. So I am happy, Bruce, to start taking questions now if anybody has any questions.
All right, coming off mute. Good stuff, Dr. Joe. I'm over here. I got to work on my coordination. I was trying that crossover thing and trying to keep falling over.
Yeah, if you're falling over, then you got to go, maybe do it sitting down first. And it happens really quick. You build up that coordination very, very quickly. The brain integrates quickly.
Yeah. Okay, good stuff. So we're going to go start Q&A. If you have a question, be sure to put it in chat or raise your hand and you can ask your question directly. So we have Marion's question here. He says, excellent information, Dr. Joe. There's a multiple brain injury survivor and not in my early 60s. Are some key dietary things I can do. What can I do to support brain health? I know you've hit on it already, but can you give a few important ideas?
Oh, absolutely. Well, this is where you want to make sure the nerve supply and blood supply to the brain is working. So the basivertebral artery runs between your cervical vertebrae. So if you have a rotated cervical vertebrae, you could be putting mechanical pressure on the basivertebral artery. And that's where something like chiropractic care to realign those bones to open up the basivertebral artery is vital. Monitor your blood pressure. You have to have enough of it. If it's too low, it's an issue. That's usually an adrenal gland problem. If it's too high, let's start looking at things that can naturally lower blood pressure. Beet powder, high in nitrates, which converts into nitric oxide, great. But beets are high in oxalates, and oxalates can increase your risk of kidney stones. So citrulline, we kind of brushed that out earlier, comes from watermelon. So watermelon, citrulline converts into nitric oxide to open up the blood supply and get the blood flowing into the brain. The cross crawl is vital for us traumatic brain injury survivors. And then avoiding the things that clog up the blood, specifically those heavy saturated fats like meats and dairy products. So you can switch to, again, if you're going to do it organic, but there's every dairy product, there's an alternative out there now. Soy milk is probably going to be, soy or coconut milk are going to be your best bets. Make sure the soy is organic, though, because soy is sprayed with glyphosate, and glyphosate can destroy the bacteria in your colon. It's a weed killer, same weed killer you spray on your lawn. So coconut and soy would probably be the 2 best milks to switch to. And as far as sweeteners go, you want to make sure the brain, the mitochondria in the brain are working really well. So you want to avoid, sweeteners would be like stevia, but you want to avoid seed oils. That would be corn, canola, safflower, sunflower. The seed oils are processed and they clog up the cell walls of the mitochondria. This is real simply put. And the mitochondria can't get food in and waste products out. So the only oil you should ever use, there's 3 of them: extra virgin organic coconut, extra virgin organic olive, and avocado. That's it. So get those other oils out of your life, and that'll prevent the clogging of the mitochondrial walls, and that'll help with the brain as well. And then one of the best things we can do for us traumatic brain injury survivors is keep the brain active. Attending the seminar today, excellent exercise for the brain. Our podcast, Dr. Joe For the Health of It, we put out 2 podcasts a week in this studio right here, and listen to the podcast. So instead of just wasting your time, and not just my podcast, any podcast that's going to give you new information is great for the brain. So there's a lot you can do. All right, next question. I want to stay in.
That's good, Dr. Jones. Send me a link to that podcast when you get a chance, or I could get it off your website and I can share it with everyone.
Okay, if you go to the bottom of my homepage on my website, I'll say the Dr. Joe Show. The podcast right now, we have it on YouTube, and we're having trouble getting into our YouTube channel. We have I don't know how many followers. But those 2 links, the Dr. Joe Show is my Sunday Night Live show where I take questions, and then the podcast is underneath it. But if you can't get it, Bruce, let me know. It's on the bottom of the website, all the way down the bottom of the page. Send me an email. I'll send it to you.
Great. Sounds good. Okay, we have a question from Shanique. Regarding gut health, what is your take on kefir, sauerkraut, kimchi? What else other than pre and probiotics and apple cider vinegar helps to improve gut microbes?
Excellent question. Kefir, I'm not a fan of it because it's dairy, and in Georgia you have to pasteurize your dairy before you sell it. So even if it's kefir or yogurt and it says whatever trillion units of probiotics, once they pasteurize it, it kills off most of it. So that whole myth about yogurt being good for the colon, not true. Now, if you're going to do yogurt, do a coconut yogurt. That would be a better choice. Sauerkraut, spectacular. Kimchi, excellent, but make sure it doesn't have fish sauce in it or shrimp in it, because that's going to be high in glutamic acid. Make sure the sauerkraut isn't pasteurized, because a lot of these probiotic foods, they pasteurize them. It kills off the good bacteria and the bad bacteria. So the best thing we can do for our gut is eat fiber, because fiber, there's soluble and insoluble fiber, and there's different types that will actually feed the bacteria in your colon. And this is going to sound weird, but when you eat something, you don't really digest it. Your stomach breaks it down and your pancreas kicks in, your gallbladder. But then the bacteria, and it's, again, very simply put, eat that food and spit out what they don't want. That's called a postbiotic. And that's what you absorb. That's the short chain fatty acids. That's the B vitamins. So eating a high fiber diet, eating like Larry did for 4 days, a plant-based diet, or the way I have for the past 40 years, you're giving those probiotic, the prebiotics to the colon every day. And then you can take probiotic supplements, but make sure it's a quality one. My German grandfather used to tell me, Joseph, always buy the best. It's always cheaper in the long run. So if you get one of those off the shelf from, a big box store, chances are the probiotics are dead. But eating a high fiber diet is going to be the best thing you can do for the colon. And if you send me an email through my website, you could just, it's drjoe.com, or Bruce, if you want to send out my email address to everybody, send me emails. I'll send you shows I did on topics like this. I did a whole show on digestion. So.
Awesome. All right, we have a couple of hands raised. We're going to go to Craig first. Craig, you want to come off mute and ask your question?
Yeah, absolutely. Hey, Dr. Joe, really enjoyed your presentation. Phenomenal. I actually have 3 questions. Sorry.
Go ahead.
I have high blood pressure. I'm on hydrochlorothiazide and amlodipine. How do I get off of that? That's first question. Second question, you mentioned citrulline for high blood pressure. Is that a long-term solution? That's second question. Third question is pulling the stomach down. You mentioned as possibly working with, the acid reflux, or maybe possibly a high blood pressure solution as well. How do you pull that stomach down? I think that's my third question.
Okay, so physically we go right here, right? It's right below the breast, basically. The stomach is on the left side, and we slide our hands out. You're laying on your back, and as you breathe and you exhale, we pull the stomach down further. It doesn't hurt. And then we do that 3 times, and we flip our fingers, and that irritates what's called the lower esophageal sphincter, which causes the sphincter to close to prevent the stomach from sliding back up again. Sometimes it works in 1 visit. Sometimes it takes, 5, 10 visits. But it's such a simple, easy fix. So the citrulline converts into nitric oxide, wonderful way to help lower the blood pressure. Fixing the gut, wonderful way to lower the blood pressure. And then dietary protocols as well. Salt has gotten a bad rap. Now, table salt is horrible. White table salt is horrible for everything. But if you do something like air-dried sea salt, Celtic salt, Baja Gold is going to be the best one out there. You're going to get about 80 different minerals along with the sodium and the chloride. So it's actually good for you as opposed to being bad for you. So, Craig, if you send me an email through my website, drjoe.com, I have a show I did on blood pressure. I'll send it to you. Might be on my YouTube channel. If it's not, I'll try to find a link to it. But it gives you a whole breakdown on blood pressure. But the number one medication I see come in my offices for the past 41 years, blood pressure medication. And there's so many protocols we can do to naturally bring it down. And it's the biggest complaint I get. I've been in practice 41 years. Biggest complaint I get is, why didn't I do this sooner? Why didn't somebody else ever tell me that there was something else I can do? Is it going to work? I don't know. If it doesn't work, so what? Very low risk, very high reward. Why not do it? So, yeah.
Right. Thank you, Dr. Joe.
More questions?
Sure. Our next question is from Dr. Jennifer Miles Brown. Jennifer, you have your hand raised. You want to come off mute?
Yes. Hey, good afternoon. Thank you so much, Dr. Joe, for this amazing conversation. You took me back to my doctoral days when I studied gut inflammation and low-grade inflammation and how soluble fibers can protect against it. So this has been awesome. But my question is going back to the Akkermansia that you mentioned for naturally producing GLP-1.
Right.
So for someone with type 1 diabetes just managing insulin manually, are there specific foods or prebiotics, fasting protocols, or something like supplements that have shown benefit without increasing glucose variability?
Oh, absolutely. Yeah. Something as simple as Ceylon cinnamon. Ceylon, that type of cinnamon every day. Sprinkle a teaspoon or so on your food. Stabilizes blood sugar. Okay. Vinegar. We talk about vinegar. Vinegar with a meal stabilizes blood sugar tremendously. Berberine is a supplement. Stabilizes blood sugar. I've got a supplement. I have my own line of supplements. I'm not trying to sell you anything. But we have one called Glucose Guard. And it has all those in one place. And it's wonderful. It just has everything in one place. And then the fiber, of course, is going to slowly push the sugar through your colon, and you get a slow release of the sugar, so you don't get that spike and then crash. And it's also going to block up some of your sugar receptor sites in the colon, so you don't absorb as much sugar. So, and then also a protein. If you have a handful of walnuts or almonds, that'll slow down the sugar absorption as well. So there's several protocols you can do to naturally stabilize that blood sugar. Yeah.
Awesome. And I do have the Ceylon cinnamon. That's the only cinnamon I use. So that's good to know.
Beautiful. Berberine's another good one. Berberine's like the granddaddy of them all. So that might be something to consider as well. Yeah.
Nice. Thank you so much. I appreciate you.
Thanks, Doc.
Let's see. Shanique has another question. Could you talk a bit on the benefits of the ketogenic diet?
Okay. So the traditional ketogenic diet is no sugar, very low carbohydrates, high meats, high animal proteins, short term, phenomenal. Originally, the ketogenic diet came out for people with seizures. That's how it started. And we put people on a ketogenic diet, the seizures would decrease. And we said, this is great. Well, one of the side effects was people start to lose weight. So now we kind of jumped on this bandwagon of the ketogenic diet. The problem with it is long-term use. I never recommend a ketogenic diet for more than 3 months because the brain runs on glucose. We talked about the mitochondria. So the brain runs on glucose, and now you can produce your own glucose. If you're eating a high ketogenic diet, the liver converts glucose through gluconeogenesis into proteins into gluconeogenesis, into carbohydrates and sugars, and that makes the brain work. But long-term, we're seeing heart issues, we're seeing sexual dysfunction, we're seeing kidney. The kidney doesn't do well with high-acid diets. So I'm not a fan. If you're going to do the ketogenic diet, I'm begging you, please, organic animal proteins only. When we were kids, everything was organic. That wasn't even a word. Now we have to label it. So I'm not a fan of the ketogenic diet long-term. Now you can reduce your processed sugars, do like a pseudo-ketogenic diet, and you just cut out your processed sugars, your breads, cookies, cakes, donuts, pastas, and you eat more fruits, vegetables, nuts, and seeds. And that works well. And in fact, Bruce, if you remind me, I'll send you a link that I did called So What Can I Eat? And I'll send you a lecture I did on So What Can I Eat? It's a real simple, it's a fun little thing. It's kind of like this.
Great.
Okay.
All right. Any other questions? I don't see anything in chat. Anybody want to come off mute and ask a question directly?
Got 5 minutes.
Yep. So got a little bit of time.
Oh, what I'll ask about is regarding the ketogenic diet and diabetes? Do you?
Yeah. Do I recommend it?
Yeah.
Oh, absolutely. The ketogenic diet, we think about just eating meats as the ketogenic diet. But if you cut out those processed sugars, absolutely. If you're eating a plant-based diet, which I eat, I've been eating that for 41 years, I can't imagine not doing it. Fiber every day. Every meal should be fiber, not as an addition, but everything should have fiber in it. And so the ketogenic diet, cutting out the processed sugars, absolutely. And then doing the things like the berberine, the vinegar, and things like that to stabilize that blood sugar. And type 2 diabetes is almost always nutritional. Type 1, of course, is different. But the same protocol works for both to stabilize that blood sugar. And so make sure you're getting that fiber in there. Have a carrot salad. In fact, I had a carrot salad yesterday for lunch. I just shredded up some carrots. I put some coconut yogurt on it and some raisins. Super high fiber, high energy. I don't have that afternoon crash. It's going to stabilize my blood sugar throughout the day. And again, Bruce, if you send me, I'll send you the link on So What Can I Eat? I break it down real clearly. Breakfast, lunches, dinners, snacks, parties, raising kids, going to Christmas. Really easy. And the key is that it's cheaper than anything you're doing right now. That's the best part of it. So the ketogenic diet is great, but I don't recommend the high animal proteins.
Okay, thanks.
I think we can take one more. Craig McEwen, you have your hand raised. You want to ask another question?
Greg?
You can come off mute. I'm going to ask you to come off mute.
Oh, there it is. Sorry about that. Again, multiple questions. Again, Dr. Joe, what is your opinion about elderberry? I think is the name of it. And
yes.
You just mentioned afternoon crash. I typically get that around 2, 3, or 4 o'clock every day. So what can I do to avoid that, stop that? What can I eat or do to avoid or stop that afternoon crash? And again, the first question was, what is your opinion on elderberry? I believe is the name.
Elderberry is phenomenal. It's one of the few things that actually works on viral infections. Garlic works on viral infections as well. And as you know, you can do antibiotics for bacteria, but viruses kind of sit there. So the elderberry actually stimulates the immune system. And the garlic has sulforaphane and other things that can actually help attack the viruses as well. Oil of oregano, very good for viruses as well. Not instead of the medication, in addition to the medication. The afternoon crash, very simple, Greg. Just write down everything you eat and see how you feel. Then switch it up a little bit. Have yourself a big salad one day. Put some chickpeas in there, some lentils. Put some vinegar in there to stabilize the blood sugar. And notice how you feel after that. And I promise you, 1 or 2 days, you're going to go, oh, the pizza made me crash. That's why I'm tired every day. It's not hard to figure out. And make sure you're hydrated. Make sure you drink enough water, because a lot of people are just fatigued because they're dehydrated. And at our age,
that's my problem. Yeah.
Okay, you drinking enough water? Good. Perfect.
Yeah, need to.
Okay.
Thanks.
Elderberry's great though. And good for kids too. It's very safe for children. So. Okay. All right, more?
I don't see any more. I think we'll go ahead and wrap up.
Okay.
This has been a great session, Dr. Joe. I sure appreciate it. I've been over here taking all kinds of notes and learning lots. I don't know if you remember my wife, Linda, when we were at the Execs on Deck, but she really liked you. And I'm going to have to share this video with her as well. So we are recording today's session. I'm going to send out an email to everyone, probably this evening, with recording, the evaluation. Dr. Joe, any resources you want to email me, I'll include those in the
my email is if you want to give everybody my email, please feel free. It's drjoe@drjoe.com, drjoe@drjoe.com. drjoe.com is our website. And if any of you in the hospital world, if you want to talk to me about incorporating some of this, not only in your own life, but professionally, I'm happy to help out in any way I possibly can.
Great. So I'll include that in the email. What else? Oh, instructions for self. Today's session had 1 hour of ACHE qualifying education credit. I'll show you how to report that in the email that goes out. And so anyway, thanks to everyone for joining today. I'm going to see some of you tomorrow for our Board of Governors class. Thanks to the folks that are on here that are doing our class tomorrow. And I think that's it. Be sure to complete our evaluation for today's session. And if I don't see you tomorrow, have a great weekend. And thanks again, everyone.
This was one of the best ever. Great. Thank you.
Thank you so much for having me. I'm really honored.
Awesome.
Thanks so much. Invite me back. We'll talk soon.
Absolutely.
Take care. Bye-bye.